Namaskar, doctor.
Namaskar.
Uh, so we have been talking to various, I will say, visionaries who can give some sort of a wisdom and guidance to the masses to do best in that particular field when we are celebrating our 100 years in 2047 and beyond that, of course. So one of the important topic I thought is health of the nation, and especially when they say 75% of the communities in rural India. So I think it makes it more important to know how we can improve that part. I'm first of all very overwhelmed to have it in the program, and
Don't be.
secondly, so the Padma Shri and Magsaysay Award winner person who is doing excellent job, leaving his hometown, coming to the state wherein good amount of service is required, and with fighting with all the adverse situations, the challenges, and still enjoying the job. So I think you're the best person to talk to on this topic. So, Doctor, first, we heard that. Cancer, especially since you are an oncologist, cancer is a lifestyle related disease, and it generally these people become victim. Why are you treating almost 50% of Assam because of cancer? Is what my first doubt is.
So, cancer is a lifestyle disease. That is correct. So, if you look at India,
Mm,
about 60-70% of cancers are caused by tobacco,
mm,
areca nut use,
mm,
alcohol consumption, our dietary preferences and practices, lack of physical activity, and some infections and inflammations. That's all. Only these cause a large majority of cancers in India. So if you address these causes, you will be able to prevent many cancers. Leave cancers aside for 1 minute. Let's forget about cancer. You look at heart disease. Why do you get heart attacks? Tobacco, alcohol, dietary preferences and practices,
absolutely.
lack of physical activity.
Mm.
Heart attack happens because a blood vessel in the
Yes.
heart gets
Yeah.
narrowed or blocked.
Yes.
Why do you get a stroke?
Mm.
Stroke is nothing but a blood vessel in the brain gets blocked or a blood vessel ruptures. Tobacco, alcohol, dietary preferences and practices, lack of physical activity. If you look at diabetes,
Mm.
many reasons for diabetes are unknown, but of the reasons that we know or the reasons that can aggravate diabetes: tobacco, alcohol, dietary preferences and practices, lack of physical activity. Why do you get high blood pressure, hypertension? Tobacco, alcohol, dietary preferences, lack of physical activity. Why do you get peripheral vascular disease? Why do you get COPD? Why do you get so a large number of non-communicable diseases are caused by the same set of factors. All right, so when you prevent cancer, you also prevent heart disease,
Mm.
you also prevent stroke,
Mm.
you also prevent or make diabetes more easily
Mm.
controlled, you prevent hypertension, you prevent COPD. So many diseases
Yeah.
can be prevented.
Yeah. Yes.
When you look at the average cancer patient that comes into the hospital,
Mm.
it is not uncommon for a patient with cancer to have diabetes
Mm.
or hypertension
Mm.
or have had a
Mm.
stroke
Mm.
or have had a heart attack. It is not at all uncommon
Mm.
for a patient to have other non-communicable diseases. All right. So in order to promote, so when we prevent cancer, we actually prevent a whole lot of other diseases. In other words, we are promoting health and wellness in the community.
So, sir, there is another very popular terminology called stress, and they say stress is causing every other disease.
So stress is a state of the mind and is a response to our environment. And there is some evidence correlating stress with certain diseases. Now, whether stress results in cancer
Mm.
is unclear. We don't have any evidence
Mm.
to say that so far. Okay, but then it is um, so when we talk of health, we talk of
Mm.
physical health and
Mm.
mental health.
Mm. Mm.
So when we talk of mental health, management of you know stress as a result of work or home
Mm.
place
Mm.
is part of overall health when we talk of health, promoting health.
Sir, again and again, I think many people like you who are doing service to the mankind in various places, especially the remote places. And what is my observation is, because I have been also part of few such initiatives, uh, acceptance of modern medication and test and visiting the doctor regularly is a major challenge among such people. What can we do to improve on that part?
A lot when we provide healthcare, just having a hospital, doctors, equipment, providing low cost services is does not mean everybody will accept
Mm.
care that you provide.
Mm.
There are several barriers to people accepting the care that is provided.
Mm.
And one of them is their own thoughts and biases. There's a lot of
Yes.
misinformation
Yes.
because of social media, but there is also a lot of misinformation because of traditional beliefs.
Traditional belief.
So one of the very common thing, forget drugs and treatment.
Mm.
So in order to prove a cancer, we
Mm.
have to do a biopsy. We have to take a small amount
Yes.
of tissue. The
Yes.
minute you say biopsy, they will just disappear because there's a very widespread prevalence that if you take a biopsy from a cancer, it will cause the cancer to rage like a fire. And so the minute you say sir हमको biopsy नहीं करानी, I don't
Ah.
want to have a biopsy. आप बिना biopsy के treatment करो. And they will just disappear. Very common
Mm.
occurrence.
Mm.
Same way about surgery also. There's a
Mm.
very widespread belief amongst
Mm.
many people that surgical interventions will aggravate the cancer.
Oh.
And so these are all myths that you
Yeah.
have to deal with.
Yes.
Even I see I spoke to you about tobacco.
Yes.
Many communities
Mm.
they believe tobacco, so they will make a tikka of tobacco, they'll mix it with
Mm.
all sorts of things,
Mm.
and then they will stick it on the forehead or on the
Oh.
head,
Okay.
saying that that wad of tobacco will cure them of their jaundice or whatever thing they have. And so these are deeply rooted. And then there are native healers, indigenous healers in the community
Mm.
who
Mm.
practice
Mm.
a
Mm.
variety of
Mm.
treatment modalities,
Yes. Yes.
and they also contribute. And they are the doctors available next door.
Yes.
And so they provide very low cost
True.
treatment.
True. Yeah.
And then see what happens is many times when we have fever, cough, or many ailments that we have,
Mm.
even without treatment, they will heal, they will disappear. And so when the native healer prescribes something and it disappears, it reinforces the
Mm.
faith in the
Mm.
community
Mm. Mm.
because they've
He
seen
did
so
something
much
and I'm
becoming
in.
better.
Yes. Yes.
And these people have a lot of influence. And
Mm.
if they say something, it acts like, wonder. They will follow. They will.
Yes. Yes.
And as healthcare workers in the community, it is very important for us to learn to build alliances with these people, to take them
Mm.
on our side and get them to
Mm.
propagate what we say, that these are the
Mm. Mm.
causes of cancer, that cancer can be
Mm.
treated only by
Mm.
chemotherapy, radiation, surgery. So it is very important to build networks with everybody in the communities and turn people with differing opinions turn them around to your thought process. Instead
Yeah.
of taking them as treating them as competitors,
हाँ.
instead of belittling them in public,
Mm,
oh, उनको
mm,
कुछ नहीं आता, no, no,
mm,
they are very fine.
mm,
But call and talk to them and get
mm.
them to
Confidence.
understand your.
Yeah.
Uh,
Yes. Yes. Women health as it is ignored even in urban society. So in rural society is even more challenge. Though we have various groups called Asha and other things who should be going to the ground level and educating these people, but a lot of work is required. What kind of awareness and education we need to give to this vulnerable section of the society?
mm. So what you say is true. They are, but surprisingly, in the Northeast,
Mm,
the the if you look at my hospital, 50% of people who come to the hospital are women.
mm.
And abandonment rates amongst women is very, very low.
I see.
Most the yeah, yeah. So that 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 gender bias
Mm,
against women
mm.
is not very strong here.
In Northeast.
But
Mm,
then,
mm,
but so when they are sick, they will come for treatment and they will have people who will bring them for treatment, just the same as men. There's
mm,
really no difference.
mm.
But what happens is women's health does take a back seat because women themselves are unaware of what is happening with them. They're not aware that a lump in the breast could be a cancer. They will go and see somebody, somebody will say, oh, ye kuch nahi hai, nothing. And so they will wait. So if you look at cancers that happen in women, breast and cervical cancer are the commonest cancers. Almost
Yes.
all of them will
Yes.
come with advanced disease.
Yes.
Breast is an organ the woman will feel every day when she bathes. When she applies soap and water, she will feel that lump slip under the finger. And a 2 centimeter, 3 centimeter lump can easily come to the hospital. But the average size of the cancer will be about 10, 12
Mm,
centimeters. Sometimes it will have
mm,
ruptured out.
mm, mm.
And see, if you treat a 10 centimeter lump, the chances of
Survival
long-term
is, yes.
survival is less
Yes.
than 40%.
Yes. Yes.
When you treat a 2 centimeter lump,
Yes.
the
Yes.
chances of 5-year survival is more than 80%.
Mm, mm,
And so it's a pity that a woman, at least cervical cancer,
mm.
I can understand they don't see it unless there
Yes.
is bleeding and
Yes.
discharge
Yes.
and foul smell.
Mm,
So they come late.
mm.
It's okay. But breast cancer, they should not be coming late.
Ignorant. Mm.
Yeah.
So, sir, problem is really large, and how much ever we do is not sufficient. So, what will be your word of advice or
Yeah,
caution?
yeah. My thought is all of us who are in the healthcare uh, environment
Mm,
have to join hands. We should not view each other as
mm,
competitors,
mm,
whether we are in the government
mm.
or in the
Right.
for-profit sector
Yes.
or in the not-for-profit sector. We are all partners.
Mm,
We may have different objectives.
mm,
The biggest player in the
mm,
whole story is the government, and it should be the government.
mm,
What the government can do,
mm.
none of us can do. No individual institution or
Exactly.
organization.
Exactly. Mm,
Yeah, and so it makes no sense to belittle what the government is doing or
mm,
to think,
mm.
treat the government. So all of us need to be able to, and we all support each other.
Yes.
And so I think for healthcare, for us to be successful, each of us has advantages.
Mm,
What the government has the advantage of resources. Private sector has the advantage of speed. So things will government for variety of reasons sometimes things move very slowly.
mm,
In the private sector, it doesn't move slow, it moves fast.
mm.
But then the for-profit sector is expensive. The not-for-profit sector is constrained for resources. So each of us have our own
Challenge.
minus points and
Yes.
our own plus points.
Yes.
And if we channelize all our strengths,
Mm,
together we will make a huge difference in the community. I think if we learn to work as
team.
part of a larger
Mm, mm,
coalition,
mm.
we will do much better. See, polio eradication,
Yes.
the private players helped in a very big way. Rotary helped in a very big way in making sure that we reach vaccination to all corners. And so that is a remarkable cooperation between government and non-government. And this is something we should do for non-communicable disease, especially for creating awareness and
Yes.
promoting early detection. The other thing that a coalition like this can also do is today, unlike some years ago, there is a lot of resources available to help
Mm,
people go
mm,
through investigations and
mm,
treatment.
mm.
There is Ayushman Bharat,
Yes.
but there are also individual state
Yes.
insurance schemes.
Yes. Yes.
And then there are several organizations like the Indian Cancer Society and
Yes.
so many organizations that also come forward to support cancer care for diagnosis, for
Yes.
treatment, for
Yes.
and
Yes.
so organizations which are in healthcare, whether government or non-government, have
Mm,
the knowledge of these resources. And apart from promoting awareness about cancer causes, treatment, diagnosis, blah
mm,
blah blah,
mm,
we also have to spread awareness about the kind of resources that are available for the common man, so he or she does not feel threatened
mm,
by a diagnosis of cancer
mm,
for
mm,
want of resources.
mm. Not only threatened, they, as you say, they do not have simple idea where is it available and how to approach.
Correct, correct.
Yes.
And so it is important that we also propagate the
Mm,
information in
mm.
the community.
Yes. Sir, very specific question, but I still want you to throw light on this. Uh, there are some states, northeast, some states, and some states in east, in the sense Maharashtra, Gujarat, Bihar, Jharkhand, those states. More of a mouth cancer patients in that area. And as you said, tobacco chewing is the culprit for all this. Having said so, I mean, I know we cannot do much about it, but still,
We
uh,
can do a lot about it.
yeah, but that mindset has to come, that readiness has to come from both sides, government and the private sector. Sir, a very simple worker is also habitual of chewing tobacco. In fact, they are the more who are in this thing. They are also suffering from heart attack due to this tobacco chewing habit. Still, why are we promoting tobacco chewing in a various ways?
So we're not promoting,
Mm,
but we are not, and over the last many years, taxes on tobacco products have gone up. But what has not happened is the BD industry has not been um, addressed
mm,
sufficiently.
mm,
And that is one of the reasons that we have continued. And then chewing tobacco.
mm,
Chewing tobacco has no taxes at all.
mm.
And so
Ah,
because
okay.
so the tobacco laws, somebody has to sit down, and there are several people working on this, but all of them have to sort of put their heads together to see
Mm,
how the tobacco menace can be um, addressed in a more
mm.
wholesome
Yes,
fashion.
yes. So hygiene is another very major concern in rural India, and I will not compare with urban because they have their own challenges, but especially rural India, clean drinking water, clean lavatories, awareness about the women health issues. Also, as you say, taking the immediate help from the medical aid when it is really going to be useful. These are the really major areas wherein a lot of work is required, sir. Can we start this kind of education at a very basic level, like school level? Um, I don't know, maybe hospital level, yes, it is happening, but nobody is educating them on this part, that this few simple steps can possibly save them.
Yeah, I think that's a very important thought and suggestion, that education on health, education on hygiene,
Mm,
education on environmental cleanliness must start in
mm,
schools.
mm,
So if we want to have Swachh Bharat,
mm,
The best way to do it, in my opinion, is to start from
School.
primary schools.
Mm.
In 10 years, the kids will learn that they should not throw garbage. The
Mm.
kids will learn that they must not, use public spaces
Mm.
as open air
Mm.
lavatories.
Mm.
Kids will learn many things which they will go back and tell their parents.
Items. Yes.
Parents may or may not change, but in 10 years, you will have a
Next generation
generation
will
of,
change.
yeah, the
Yeah.
whole generation will bring about
Mm.
change. And the
Change.
surest way to making India swachh,
Mm.
to ensure environmental
Mm.
cleanliness, is to focus on. So it may not happen in today's
Yeah.
time,
Yeah.
but in 10 years' time, 12 years' time,
Yes.
15 years' time, we'll have a whole generation that is attuned to this. So the same is about practices also.
Yes.
Often when I go and meet people, school administrators, they say, let us talk to kids who are in the seventh standard, eighth standard,
Mm.
10th standard.
Mm.
But I think it is important for us to start talking of
Very.
healthy practices much earlier, much, much, much earlier.
Mm. Sir, one
And this has
final.
to be repetitive,
Yes.
iterative, year
Yes.
on year on year
Mm.
on year.
Yeah.
This has to happen.
Come. True. True. It has to get really imbibed at lowest strata of the society. Sir, one last question I would not say, but just a statement. Uh, Sir, there are ample challenges, hurdles while doing a service like you are doing. Um, Getting the medicine, getting the response from the patients, and having the resources, etc., etc. What keeps you going, sir?
So, several things. One is when you see the community transform in front of you, not because of you, but because of a large team of people,
Mm.
very inspiring.
Mm. Mm.
When you see your own colleagues
Mm.
growing
Mm.
in as professionals, as individuals, it's very, very inspiring.
Satisfaction.
When you see a family, grow,
Mm.
their kids going into college, and they come back and tell you they've passed college, they've gotten into employment. When they come and ask you, can I buy a house? Can I buy a car? These are all very, and then even probably the most touching thing is you treat somebody and the patient doesn't do well and the patient dies. But 1 year later, the same family will come with another patient, in the trust that the first patient was, even though the patient died, he or she received good quality care, honest care, and so they want to bring another patient to you. These are all things that, are very, very uh, inspiring and motivating.
Thriving. Definitely. Yes.
Promoting health is a national responsibility. Every citizen has to take care of his or her own health and has to ensure that others also do the same. So in India we have a population of 1.4 billion or a little
Yes.
more than that.
Yes.
And out of that, when we talk of screening,
Yeah.
we talk of examining people who don't have any symptoms.
Mm.
And that's a huge population,
Mm.
nearly 300, 400 million
Yes.
people
Yes.
will be
Which is
screen eligible.
unnoticed.
We cannot do that.
Mm.
Yeah. But if we promote
Mm.
awareness about warning signs of cancer, of heart disease, of
Mm.
stroke, of
Mm.
diabetes, we will have more people go and get themselves examined earlier
Mm.
because they have symptoms and they will be treated, and a lot of unhappiness and morbidity can be avoided.
Okay. It was wonderful talking to you, sir, and thank you for your time and that wisdom.
Thank you. Thank
Wishing
you
you
very
all
much.
good health and all the best for your noble work.
Thank you. Thank you. Let's join hands to
Yes.
do this better.
Yes.